Hello, everyone, and thank you for joining us for our new career development webinar entitled The All of Us Research Hub, a deep dive into NIH's All of Us Research Program. Let's get everyone settled just for a little bit to make sure we're all logged in, and then we'll get started. And we do want to let everyone know that this webinar will be recorded and posted on our YouTube channel. Before we get started, I'll be giving a brief intro about NRMN, the National Research Mentoring Network, and our speakers, Ashley Green and Gage Ryan. All right, so some brief background. Founded in 2014, NRMN is an NIH grant-funded initiative whose entire purpose is to diversify the STEM workforce. We do this by providing researchers across all career stages in the biomedical, behavior, clinical, and social sciences field with evidence-based mentorship and professional development programming that emphasizes the benefits and challenges of diversity, inclusivity, and culture. Our program achieves that through mentorship, networking, and professional development through our online networking platform, MyNRMN, which has over 20,000 mentors and mentees. We encourage everyone to visit our website, nrmnet.net, to learn more about our resources. NRMN is happy to have Ashley Green and Gage Ryan join us for today's webinar. Ashley Green is the lead outreach coordinator and a research analyst for the All of Us Data and Research Center, and is also a member of the demonstration project team where she works closely with demo project researchers as they work toward publishing their research. Her background is in information science and education, and she is passionate about user access to data and information. Gage Ryan is an associate IT business analyst with the All of Us Research Program, working directly with the research support and outreach teams. He enjoys being able to facilitate researchers' success within the Research Hub by providing answers to help desk tickets and developing new support materials. He also finds it's a great privilege to speak to new groups of researchers through outreach and events. He looks forward to advancing precision medicine through the great opportunities of the All of Us Research Program. NRMN is delighted to provide this opportunity for everyone to participate in this webinar and have your questions directly answered about the All of Us Research Program. We will be offering a Q&A session at the end of the presentation, so we encourage you to type any questions you may have in the Q&A feature down below. From NRMN, we want to give a special thank you to Ashley Green and Gage Ryan and the All of Us Research Program team for making this webinar happen. And now I'll pass it over to them to begin the webinar.
Good afternoon. Now, I'll actually kick us off before Ashley and Gage. My name is Dr. Kareem Watson. I'm excited to be here to introduce our team, to turn the floor over to Ashley and Gage. But first, I just want to walk you through the objectives of the All of Us Research Program and tell you a little bit more about the All of Us Research Program. Next slide. So today, in the next 10 minutes, what I hope to do is actually share the mission and objectives of the All of Us Research Program and highlight our program's efforts to connect minority researchers, particularly students and trainees, and describe our All of Us Research Hub and how to access data, tools, and surveys. So next, I'm going to just give you a brief overview of the All of Us Research Program. But next slide. So first, I'd like to thank all of our community partners and participants across the country who make our program possible. Literally, because of all of the logos that you see here, while these are reflective of a logo, these are actually people and partners who actually make this work possible, and I want to thank them all. Next slide. Same to our consortium partners. Many thanks to our consortium partners who manage various aspects of the All of Us program. The All of Us Research Program is a huge initiative and a huge undertaking, and it literally takes a team effort, many of who you see represented here, that allow us to truly be an inclusive and engaged program. And Ashley Green and Gage Ryan from Vanderbilt University, where the All of Us Data Research Center is located, are presenting with me today, as I said before. So an innovative research effort. So some of you may be familiar with the All of Us Research Program already, but I like to review some aspects of the program that I think makes it unique. The All of Us Research Program truly understands that representation matters and diversity is at the core of our work. All of Us is building a cohort of 1 million or more individuals that truly, from all walks of life, with an emphasis on including communities that have been historically underrepresented in research. You may hear this referred to sometimes as UBR, historically underrepresented biomedical research. This includes racial and ethnic minorities, and in the future, it will include children. It also includes sexual gender minorities, people living with disabilities, residents of rural and non-metropolitan populations, and people with inadequate access to healthcare, low income or low educational attainment. The program's goal is to have 75% of our participants from groups that are historically underrepresented in research, and to be 50% of those participants to be racial ethnic minorities. And we are proud to say that we are currently achieving those goals. And this concept of research with communities is reflected in the fact that All of Us includes participants as partners, even in our governance structure. This is actually something that's historically not seen in longitudinal studies. And we aim to understand health including aging and wellness, which means including time as a factor, hence the longitudinal nature of the program spanning 10 years or more. We also have multiple data types to learn about the intersection of different variables on health. We, in addition to just collecting information about biospecimens, we also will collect information through wearable devices, through surveys, and even opportunities in the future to collect information on social determinants of health and others. Our research hub, which actually we'll review today, is aimed at providing a resource for us to allow researchers that reflect the diversity of our participants to also ask questions from our data set. And we want to ensure that the researchers asking questions about our data set are actually from all career levels, including trainees. Furthermore, All of Us is partnering with industry leaders to ensure that safety is paramount. Although this is the last thing I'm presenting about this, safety is actually critical to all that we do, including data integrity. Next slide. So our program's mission, what is the All of Us Research Program? As our mission is noted in the middle here, is to accelerate health research and medical breakthroughs and to enable individualized prevention, treatment, and cures for all. And one of the ways that we're doing that in the All of Us research study is by, first you see here, nurturing relationships. And this is truly where engagement comes into place, is that it's important that we, in order for us to achieve our mission of engaging 100 participants, we need to ensure that we engage our participants as partners. And one of the ways that we do this is to catalyze an ecosystem of community researchers, making sure that we have researchers that reflect the rich diversity of our data set, and then also making sure that we deliver on one of the nation's largest biomedical data sets that can exist so we can catalyze disease. And this is truly made possible by a team that maintains our culture built around the program's core values. Next slide. So one of the questions that I often get from communities, they'll say that because the All of Us research program is actually not conducting research and it's a longitudinal study, they often say, how does the All of Us research data lead to discoveries? One way is through our research hub, and also questions that researchers are able to ask and study based on data that we've collected thus far. A critical example of this study is highlighted at the bottom, where the All of Us program played a critical role in better understanding the presence of COVID-19 virus in the US. By testing for COVID-19 antibodies in our participant samples, we played a pivotal role in re-examining and highlighting when COVID-19 hit the US. Next slide. So what really sets us apart as a program and makes it an ideal space for trainees and hopefully some of the attendees today and others beginning their research career is tied to our scientific framework. As a broad program, All of Us is building a data platform that enables research in many aspects of health, and doing so without a single method, medical or biological research question in mind. Rather, our framework focuses on wellness, reduction of health disparities, and also improve risk assessment, earlier and more accurate diagnosis, and even improving health outcomes. The key word here is enable. The All of Us research program is enabling research, not performing that research. Next slide. So we are really excited that our engagement division has actually done literature research that shows that when you increase access of research data to researchers that reflect the diversity of the US, that you actually play a critical role in catalyzing new discoveries. Research has shown that teams that are inclusive that are diverse and reflective of the populations they serve are more likely to produce impactful studies. Our researcher workbench represents an early opportunity for us to increase the diversity of our researchers across demographics, career level, and institution type. I know firsthand how creating a diverse research workforce can address health inequities that we face today. I am a community health scientist by training, trained in community-based participatory research. And my work prior to coming to the NIH focused on cancer prevention and control. One of the areas I sought to do research on was addressing the lack of inclusion of African-American men in research in cancer screening, prevention, and early detection studies. And the fact that my research team reflected the populations we served, all of the studies that I conducted, we always exceeded enrollment. But more importantly, and we've published on this, we actually had findings that came out that actually helped to inform how and when to engage African-American men in research. Next slide. Engaging community members as through research established partnerships is very important. Since the inception of the All of Us research program, All of Us has built relationships with community engagement partners to ensure deliberate and inclusive outreach and engagement to groups who have been historically represented. One of the things that we heard early on from our community participants was ensuring that populations that have been historically underrepresented in research, that we would include those populations. One of our responses to that was a partnership that we have with Stanford University through PrideNet that allows us to engage sexual and gender minorities, both as participants, but as well as researchers and the research community who is intentional in asking questions about this population and this community who has historically been underrepresented in research. The same holds true for our engagement of historically Black colleges and universities. Next slide. So in May of 2021, the All of Us research program, in collaboration with Black Greek Letter Consortium, hosted its first annual minority research symposium. I was very excited to be a part of this project, actually, even before I came to the All of Us research program. The event sought to increase participation of underrepresented minorities in biomedical research, increase self-efficacy in research activities, and influence the number of underrepresented minorities that enter postgraduate and medical education. I know firsthand that engaging Black Greek Letter Consortium works. As a member of a Black Greek Letter Consortium, I knew a lot of the mentoring and engagement and opportunities that I actually achieved as a researcher were through efforts that we're actually fostering. And we wanted to invite you to save the date for March 31st, 2020. Applications for mentors and students will soon open for this. Next slide. So engaging with faculty members through our new engagement partners is another example. So we have a partnership with the Baylor College of Medicine that has allowed us to think about how we increase access to those institutions such as HBCUs, historically Black colleges and universities, and HSIs, Hispanic serving institutions in Texas, that will host their first annual underrepresented minority research conference in May of 2022. The symposium will be an opportunity for members interested in learning more about the All of Us research program and the workbench and data science to generally participate in a series of training sessions, networking opportunities, and to spark collaborations with opportunities for seed grants. Next slide. Next, I actually want to thank you all. I want to thank you all for giving me this opportunity to briefly describe the All of Us program to you. And I'm going to turn the floor over to my colleagues, Ashley and Gage, who will now walk you through the Researcher Hub. Thank you so much for your time.
Well, thank you so much, Dr. Watson. And Dr. Watson is with the NIH as the new Chief Engagement Officer for the All of Us program. And we're so happy that you could join us today and present on the program and give us a little bit of your background as well. So thank you so much for that. And thank you very much to NRMN for inviting us to present. I am very excited to be here to talk about the All of Us Research Hub. Okay, next slide. So we offer many types of data, including surveys, electronic health records, physical measurements, and wearables, and our data are longitudinal. So participant level data undergoes quality control in our curation process to ensure participant privacy. And raw data are harmonized and curated for quality control and to ensure participant privacy. So the data are kept on a secure cloud-based platform on the Research Hub. Next slide. So when it comes to data, we believe in sharing data widely and wisely. Access to the data is broad and open, and we've removed barriers to access for researchers. but we are wise about how we share the data so that we protect our participants' privacy. We balance the need for access to the data with the need for protecting participants' privacy. And preserving participant privacy and trust is a cornerstone of the program. Next slide. So to enable these principles, we have created tiers of data. And our bottom tier is the public tier. And it is broad and it is a summary of what we have. It is aggregate data and we round up by 20. Anyone can look at this by using our data browser, which can be found at databrowser.researchandofus.org. And you're welcome to follow along with that as we go along. And the level above that is the research tier, and this is participant level data. And it exceeds our HIPAA standards. Researchers must register and be approved to access it, and they access it through the workbench. And all of us uses high quality security technology and strict privacy security protocols to help keep participant data safe. And in the future, hopefully at the end of this year, the beginning of next year, there will be genomic data and researchers with the correct level of data can access them. Next slide, please. So currently we have 5 types of data that I already covered for a moment. We have the participant surveys, the COPE survey, physical measurements, electronic health records, and wearable technology using Fitbits. So our COPE survey is our COVID-19 survey that we sent out last year. And participants use this survey to record how the pandemic was affecting them. And in the future, we will be launching genomic data and biospecimens. So we curate the data for privacy and quality control before releasing it to the Research Hub, and we use the OMOP method. And we recently refreshed the data you see here to include data from nearly 15,000 more participants. Next slide. So our data set is not only rich, but also diverse. Going back to what Dr. Watson was talking about earlier, our program does aim to reflect the diversity of the country. So diversity will ensure biomedical research benefits all of us. So 78% of our participants have at least one category of underrepresentation in biomedical research, which is what the acronym UBR stands for here. 47% of our participants are non-white race or Hispanic Latino ethnicity. 29% are over the age of 65. 2% have less than a GED educational background. 27% have less than $25,000 a year of annual income, and 13% are sexual and gender minorities. Next slide. So the data set we just saw is available to researchers in the curated data repository. And these data are pushed through our pipeline about twice a year on average. And to access this data, you will first need to visit the Research Hub. Next slide. So let's take a look at the Research Hub and how to access the platform. Now, while I can't go over everything today, I will go over quite a bit. So I encourage you to follow along at researchandofus.org. Next slide. So the Research Hub is a secure cloud-based Google platform that contains both the public data and the controlled access data. Researchers can learn about the data, how to use it, and the tools available to analyze it. And participants can use it to see how their data are being used by researchers, which is one of the ways that we maintain transparency. So the Hub offers many tools that can be viewed by participants, researchers, and the public. Now, the restricted access portion of the Hub contains our researcher workbench, and this requires a researcher to register to gain access. This is where the researcher can gain access to row-level data set, as well as the tools that we have created to analyze the data. Next slide. So we offer a variety of unique ways to learn about participants and interact with the data. And these include data snapshots, the Survey Explorer, and the data browser. Next slide. The data snapshots page can be found under the Data and Tools tab. And this page gives an overview of the aggregated public-facing data and is updated daily. The snapshots provide participant demographics, geographical distribution, and more. It also provides the number of enrollment counts over time, so you can see how fast the program is growing and how closer we are to getting to enrolling 1 million participants. And I always enjoy coming to this page every few days because the participant numbers keep on going up and it's always exciting to see. Next slide. So the data browser is also located under the Data and Tools tab. This is also one of my other favorite places on the Research Hub to visit. The browser provides interactive views of the publicly available All of Us Research Program participant data. Anyone can learn about the data and the quantity of data that All of Us collects. This is where aggregate data are located. They are de-identified, rounded up to 20, and it's a great way to see if your research is feasible with the research available. Users can explore aggregate data, including electronic health record information, survey responses, physical measurements, and the wearables data. Now, this is not updated daily, unlike the snapshots page, but it is updated about twice a year. And you can use the search tool to examine topics of interest, and the results will be automatically generated below, showing you all of the data types we have available related to the search that you had conducted. Okay, next slide. So we're committed to being transparent to our partners about how their data are being used and shared. We showcase publications on the Research Hub, which can be accessed by the public under the Discover tab. And we also list the projects being conducted. Next slide. So the research directory is also located under the Discover tab. And this lists all of the current research projects researchers are conducting. Approved researchers provide their project's research purpose, description, populations of interest, and more. This information helps all of us ensure transparency on the type of research being conducted. Now, you can search by name of the researcher, title, or keywords as well. Next slide. Our Spotlights page is new and will be growing over time. This is where we highlight the work of our researchers, and you can learn more about them and their goals. This kind of brings a personal touch to the platform and gives the public an opportunity to get to know the researchers. Next slide. So the COVID-19 Research Initiatives page is a new addition to the Research Hub. The All of Us Research Program has taken steps to support COVID-19 research in a number of ways. On this page, you can learn more about the important things underway at All of Us, including the COPE survey, Spotlights feature, research using COPE survey to explore the pandemic's effects on physical and mental health, COVID EHR data, and COVID antibody study and results. Next slide. So now that you've seen a little bit of the data we offer, if you're interested in research becoming a member of our growing community, you can apply for access and register by clicking the apply button at the top. So there are 6 steps to completing your registration and gaining access. We have already gone over step 1 together, which is learning more about the data that's available. Now, step 2, you must be affiliated with an institution that has a data use and registration agreement with us. So on the apply page under step 2, you will notice a link that you can click on to find your institution. Currently, any US-based academic, nonprofit, or healthcare organizations can enter into our data use and registration agreements. And if you don't see your institution there, you can initiate the process by clicking on the last link on step 2. On steps 3 through 4, once you have checked to be sure your institution has an agreement with us, you can register and verify your identity with login.gov. And steps 5 and 6, you will complete the code of conduct training and sign the data user code of conduct. Now, steps 2 through 6 can be done at once or as you go along, and it typically takes 2 hours to complete. And we do offer new user orientation when you register and an amazing support hub to help you with any questions you may have, as well as video tutorials. Next slide. So if you notice that your institution does not have a data use and registration agreement with us, the process to initiate one begins with the researcher completing the form and found under step 2. And our team at Vanderbilt University Medical Center will then send the DURA agreement to the contracting officer at the researcher's institution. And once the DURA is signed, which DURA means the Data Use and Registration Agreement, once it is signed and Vanderbilt has been contacted, we will then add the institution and the researcher will be notified by us that they can move forward. Okay, next slide. So that is the Research Hub. We're going to now look into the Researcher Workbench, and I will turn it over to my colleague, Gage.
Hi, everybody. I'm Gage Ryan. I'm going to walk us through the Researcher Workbench, which is our registered tier. As Ashley and Kareem said earlier, we have different data tiers, and what Ashley just presented was the Research Hub, which is our public tier, and now we'll be transitioning over into more aggregate level data. Next slide. So as I mentioned, the researchallofus.org, which houses the data browser, which we just went through, is part of our public tier, and that's represented by an unlock. And then now we're going to transition over into the Researcher Workbench, which is where you will become a registered tier researcher and have access to more granular level data. Next slide. So the Researcher Workbench is built to be a collaborative workspace. You can think of your workspace as your projects. And it's got 3 main tools within it. The first one being your cohort builder, the next being your data set builder, and the third being your Jupyter notebooks. So your cohort builder can be viewed as how you're going to build your population of interest. Your data set builder is how you build a data set of the information you want to analyze. And your Jupyter notebooks is how you will actually perform analysis. Next slide. So as I mentioned, it's a very collaborative workspace, meaning that as a researcher, you do not have to participate in every level of your workspace, or if you are, or if you want to, you can. But let's say, for instance, you have a specific data scientist on your team. They can jump into the workspace or into the project at the tail end just for the Jupyter notebook part of analysis. Meanwhile, someone who is better suited for building your population of interest or your cohort, they can be there in the beginning of the workspace during your data set builder. Next slide. So to get into the Researcher Workbench, you will go to our public website, which is researchallofus.org. And then in the top right corner, you'll see the Researcher Login tab. You'll click that, and then it'll take you over into a, we use a Google cloud-based platform. So that is where you'll have your Google account linked to the Researcher Workbench, and that is how you will log in. Next slide. Once you log in, this is going to be your landing page of the workbench. So as you can see, the first thing that pops up is going to be your workspaces. And as you can see on the screen, it'll show you what kind of workspaces they are in relation to you as the researcher. So for instance, the first 2 you see, it is labeled as an owner, meaning you are the owner of those workspaces. And then the following 2, you can see they're labeled as a reader, meaning they were shared with you and you're able to read the project, but not perform any edits within the workspace. And this is just to show you how you can be a collaborator on multiple projects. They don't all have to be your own. Underneath that is your recently accessed items, which is going to show the most current actions you've taken within the workbench, whether that was building a new cohort or editing a notebook. And then below that is our quick tour and videos, which is a great spot to start your first time logging into the workbench. These are all about 2.5-minute videos, and they walk you through each step of the Researcher Workbench, starting from a general overview all the way down to using Jupyter notebooks and code snippets, and then also a brief video on how to use the User Support Hub. Next slide. So as we mentioned before, we want to be very transparent with both our researchers and fellow, or both our participants and fellow researchers. So when you fill out the workspace for the first time, this will be what the page looks like. And as you're going through, filling it out your research purpose and other follow-up questions, you'll see tags next to certain questions that say publicly displayed. And this is where they are translated over into our public website and shown in the Discovery tab of current projects within the Research Hub. Next slide. So once that workspace is filled out and submitted, all that information can be found in the About tab of the Researcher Workbench within the workspace. And like I said, this is where you can go and see, this is also a living document, so you can change this as you're working through your project. So that way, if you have to change the scope of your project partially, you can come back and edit your workspace to do that. Next slide. So once you've filled out the information in the About tab of your workspace, you can then pop over to your Data tab within the workspace. And this is going to have our first main two tools, being the Cohort Builder and the Dataset Builder. And so, like I mentioned, the Cohort Builder is where you're going to build your population of interest. You can narrow down from having all participants within the cohort up over 350,000, and you can narrow that down into particular participants. And then you'll transition over from there into the Dataset Builder, which is where you'll build your data set, and you can think of it as your columns of interest in your concepts that you want to include for analysis. Next slide. And this slide just represents our notebook. So we use Jupyter Notebook platform, and we currently have R and Python coding languages. And the great thing about using Jupyter Notebook is that it is essentially a lab notebook, a live notebook, meaning you can put real readable text within it. You can also put in your code for analysis. You can run the code for analysis and then have your output, whether that's a table or a figure, all within the same notebook. Next slide. And then last but not least is our user support hub, which is attached to the Researcher Workbench. And this is where you can find all sort of research support materials, along with, we have a community forum where you can get in contact with other researchers and post questions. We have an announcements tab where we'll put any latest information about the Researcher Workbench platform on there, including new updates to the data. And then we also have a frequently asked questions tab, which is a great place to go if you have a one-off question that you think might be not answered before. You can go ahead and put it up and search that in the search bar at the top. And more than likely, the question has been asked before. And anytime we get those one-off questions, we do like to post them in the frequently asked questions section, just so that way other researchers have easy access to them. And then lastly, we also have, you can submit a help desk ticket, and that's going to be an email directly to our help desk team. And we have about 5 people who work it every day. And so we try to answer those questions as soon as possible. Next slide. And with that said, that kind of concludes our overview of the Researcher Workbench. If there's any questions at this time, feel free to ask.
So I just saw a question come into the chat. And a lot of our questions, let me turn myself on. Hi, it's Ashley again. A lot of our questions have been answered by either our NIH or DRC colleagues, but we did just get one that came through. What if we want to use programs other than R and Python? So Gage did go over that currently the tools that we have for analysis are just R and Python, but we have received a lot of feedback from our researchers that they would like to use other tools. So we're in the process of trying to incorporate other analytical tools and programs into the workbench. We don't have a timeline yet, but one of the things I love about working with all of us is that when we do get feedback from researchers, we do incorporate their tips and suggestions, and that was one of the suggestions we have received. So we're hoping to have that implemented for researchers in the future. And just saw any cost to use the All of Us data. Currently, every researcher is given $300 credit to run their analysis. And for the vast majority of our researchers, they have used less than the $20 allotment, or less than $20 of the $300 allotment. So you are given the $300 credit to help you run your analysis. I think that's the okay, so in our Q&As, we have the question, could you expand on what the genomic data availability will be? We will have whole genome sequence and arrays. How much do credits cost to replenish? That is a good question. Let's see. So Adrienne just answered a little bit of the answer. She said, and Adrienne Roman is a member of the DRC. She's one of our senior project managers working with outreach and researchers. And so we've got the platform is free to access, but there are compute costs associated with the platform. And but the costs are very minimal with the current data set available. And we actually, I don't believe we've had anybody so far to run out of their $300 allotment.
I can chime in really quick, Ashley, about the replenishment. So right now we are in a beta phase, which means, as Ashley said, we do provide $300 in compute credits to each new user. If you do currently run out, please contact our help desk and they can work with you on adding additional credits. We will, with the launch of our genomics data, because that is so much larger of a data set, and there are a lot more opportunities for doing computations on large data, that we will be allowing users to create billing accounts within the platform where they can actually link up their different funding sources to the billing, because those genomics data, we are expected to run up a little higher costs that our free credits will not cover. But currently, as Ashley mentioned, on the data set we have available, very few people have exceeded the $300 free credits. Most can complete a full project in under $20 of compute credits.
Thank you so much for that, Adrienne. And we did just get another question in the Q&A. How do you deal with selection bias in the data set? So one of the ways that we do that, and we maintain transparency for our participants, is, and you'll be able to see this if you go to the Research Projects Directory, which I'm going to place the link here in the chat. So whenever a researcher creates a workspace, they have to explain how they have to fill out different portions of different questions about like their project purpose, scientific approaches, and so forth. And their answers and responses will appear on the Research Projects Directory. Now, inside each project that's available at the bottom, you'll be able to see a little button that says request a review of the research project. And if you encounter a research project that looks like there might be some bias, or might have questions about how they've used it, you can request a review of the research project. It will be, and then that will go to one of our access boards, and they'll review it to be sure there's no bias being done, and that the research being done is very safe.
Looks like we had another question, general question. Where is the data being collected from? I can answer this. If anybody else wants to chime in as I'm going, feel free. But the data comes from two sources, mainly, one being directly from the participant, and that's going to come in the form of our surveys, participant provided information. And then it will also come directly from a health provider organization that we work with, which is where they will release, participant allows us to access their electronic health record data. And then along with the the health provider organizations will set up their initial physical measurement where they'll collect height, weight, BMI, and other measurements, so on, like that. Currently, so I see there's another question. Is there data from clinical narrative, example, physician progress notes? Currently, we do not have free text within the platform, meaning physician notes, but it is an area that we are looking to expand and move into.
And see, we've got a couple of questions in the Q&A. So striking the balance between privacy, ethics, data user agreement, has all of us collaborate with NIH DVGAP for adherence to oversight, governance, and misuse of secondary data analysis for publications. Do any of the NIH colleagues have an answer to that one or some idea?
I'll just briefly chime in. Actually, in terms of the publications, All of Us Research Program does adhere to the same NIH standards for publications, and that any data published using the All of Us data goes to a publication committee where that is reviewed. But once a researcher is granted access to the workbench, there's a strict, I would say there's more of an upstream review of the researcher's access to that workbench. But now what that researcher publishes on, of course, will depend on the ethical response of that researcher. I hope that answers the question.
Hi, this is Courtney Wallen chiming in also from the NIH. I am happy to share more information about the privacy and security protocols. And as Dr. Watson noted, we are certainly in accordance with both NIH policies as well as the Institutional Review Board of the All of Us Research Program. So happy to drop a link in the chat about our privacy and security protocols.
And I believe we've got one more question in the Q&A box. So if a participant has been diagnosed with a disease, will their measurements be disease-based? And how will we get their baseline state pre-disease?
I can tackle this one. So yes, if a participant already has a disease when they enroll, then their initial measurements when they come in to take their physical measurements are going to be, of course, with the present disease. Now, if they release authorization to their electronic health records, then that can date back all the way until whenever they first started getting those records recorded. So those will also be available within the workbench, and that will obviously be dated, so you can see pre-disease what some of that data, what some of their data did look like. Hope that answers the question.
And another question we've received, any plans to offer additional credits to researchers from minority serving institutions that are underrepresented? I'm sorry, that are under-resourced?
Yeah, I can answer this one as well. So like we said, we give every researcher an initial $300 in credits. And when we say credits, when we replenish it, it is in the visual form of dollars. So just so that way you don't have to think about it as like $1 is equal to 1 credit. It's still visual in the form of dollars. And if a researcher is active within their project and they do end up using all $300 worth of credits, they can always contact us, the support desk, and we will be more than happy to work with them individually and get them some more credits so they can finish their project, especially because we're in beta phase currently.
And I've gone ahead and put in the email address for our help desk, and it's support@researchallofus.org. Also, in addition to asking questions about the credits, if you run out with them, our help desk team, they're amazing. They respond within 1 to 2 days of your questions. And you can also email them if you have any suggestions or any other questions you might encounter. They are very helpful. Oh, so one question, how many years of the data are available for each participant? So we did start enrolling our participants in 2018. So do you have any more background on how far back they might go, or if it's just starting from 2018?
I'm happy to chime in here as well. So of course, yes, we launched the program in 2018. So some of the survey data was not collected until 2018, but it depends on the data type, honestly. So some EHRs go back several years. I know Fitbit data can go back as early as 2009, if I'm remembering correctly. Gage, you may have more insight specifically on the Fitbit data. 2011, thanks, Haral. So it really is dependent on the data type.
And
yep, exactly.
Oh, sorry, Gage.
Oh, no, you're good. Yep, exactly. For just expand, yeah. So for instance, electronic health record data will go back as early as it has been recorded and that they have access to it to then upload it to the researcher workbench.
Actually, I also just want to briefly comment, just respond briefly to the question that someone asked about institutions that may be under-resourced, that may need additional support. We also want to encourage you to let us know if you can provide any information where if researchers go to access the workbench and run into obstacles or barriers, if we could, when they contact the help desk, let us know that, because we do want to be very responsive to ensuring that there's access and equity in our program. And there may be things that we may have missed, that we may have not thought about, that may serve as some barriers that we're not aware of.
Yeah, and to expand on that a little bit too, I think one of the greatest things as being a part of this program that we've done is making the platform essentially a mobile infrastructure, meaning that Jupyter notebooks and the researcher workbench is all accessible through a web browser. All you need is to have access to it through being a registered tier researcher. So it eliminates the need to download data, especially when you're working with many participants and many data points. Sometimes, compute costs and other memory just for downloading all that can be hard to get. So we've essentially eliminated that, being that it's all on a Google Cloud-based platform.
And you all have given us some great feedback and great questions. We still have time for more. If anybody might have any more questions you would like to ask. And you might be like me. The questions might come later on after the presentation is over. That always happens to me. It never fails. So you're welcome to go to our website, researchallofus.org, and take a look around, and our support hub. If you have any questions, the help button is at the bottom right-hand corner.
Looks like we have a question in regards to surveys. Is there a capability to look at a complete list of survey questions? So I would say the easiest place to look at a complete list of all of our survey questions would be through our Survey Explorer on the public website at the researchallofus.org. And that's going to give you a full list of the questions that are asked. The reason I suggest that is due to privacy for our participants. In some cases, when you're looking at survey questions and answers in the researcher workbench, they have been generalized. So if you want to see the exact question that has been asked, use the Survey Explorer. And then when you're performing analysis, that usually always translates over exactly into the workbench, but in some cases and some questions, we have to generalize it a little bit.
And I'm going to post in the chat our YouTube channel. So our YouTube channel has videos, recordings of how to use the workbench, use the hub, and some of our past office hours. So feel free to go there and watch the videos, and maybe you'll see something that sparks your interest. And we also have one including notebooks and code snippets. So we did have some questions earlier about coding. So we do have some of those in our office hours to talk about, as well as some of the video tutorials we have on our website. So new question, what are the annual projections of acquiring the enrollment of online cohort participants into the program within the next 5 years? So currently we have, our participants, we currently have 419,000 participants, and that number was just up from yesterday. So we're getting closer and closer to our goal, and we're hoping to keep on going past 1 million. But Courtney or Dr. Watson, or do you have any other things you'd like to add to that, or anybody else on the call?
I'll just briefly say thank you for that question. One of the things that we're doing, as opposed to thinking about a particular projection of how many participants we want to see per year, we're now getting ready to roll out into a new 5-year strategic plan that will allow us to think about over the next 5 years, what are those engagement activities, enrollment activities, and other things that will allow us to get to that 1 million or more participants.
Okay. Any other questions we can help you out with today?
And Ashley, I think before we close, I think we have an additional slide which has a small call to action, or different call to actions that we could highlight.
Yes, so you're welcome to join us at joinallofus.org. That's on our participant side, and then researchallofus.org, that's our researcher side. And if you want to be both a researcher and a participant, we would love to have you to join us. And we do have our newsletter that you can access on our website. And we are on social media, so you can follow us on Twitter, Facebook, Instagram, and we do have a YouTube videos that's plugged in for you all. And Courtney has posted some links for our user-full subscriptions, as well as the newsletter. Well, if there are no other questions, Johnny, I think I will toss it back to you then.
Awesome. No, this is great. I just want to go ahead and again thank Ashley, Gage, the rest of the team here that participated. This is just very important information and just such a great discussion that needed to be shared. So thank you so much for being here today. We appreciate it. Again, we look forward to hosting more webinars like this in our career development series. We just want to thank you all for attending, and we hope everybody has a wonderful day. Thank you.